is a chemical reality in the bloodstream based on what the brain has secreted in the process of translating that emotion from the emotional body to the physical body. It has been talked about that this emotion of fear actually can be the invisible source that makes all of us susceptible to any pathogen, whether it be the AIDS virus, the latest virus that causes influenza, Legionnaire's disease, anything in our environment can actually begin to have a pathological effect upon us if we choose to have a perception of fear around anything going on in our lives. Now that's awesome, and I just want to just kind of sum that up for you, that deciding that you are afraid of anything causes the brain to secrete neurotransmitters that will cause cells in the body to move into action in a suboptimal way that will then allow foreign invaders of a bacterial, parasitic, of a viral nature to now reside within the body. Now, when we have insecurities or fleeting bouts of fear, we will notice that as we become more confident about ourselves, when we move back into a state of more harmony, more peace, or we're actually able to experience joy in our lives, none of these bacteria and viruses are actively causing symptoms in our body. And that's what we're really asking for when we talk about good health. We're talking about being able to live a life that causes us to be totally asymptomatic as far as having any indication that the body is not capable of doing what it is that it should do and what we ask it to do at any particular time. Now, understand what I'm saying here clearly. I'm not saying that your blood might not contain a bacteria at any time or something that is a foreign invader. The chances are, however, if you are in harmony and in peace and joy, that we would not see these things in your body. But we do know that we're talking about a relative framework that these states of consciousness can be in, from being comfortable and satisfied to being ecstatic, which are all forms of harmony, peace, and joy. But they do actually allow the cells to work at different levels that are beneficial to your existence. We see the same thing in relationship to anxiety states, all centered around this emotion known as fear. That depending upon whether the fear is a mild sense of just not being able to rise to the occasion, only temporarily, to totally feeling devastated and that you cannot continue to live, will actually determine to what extent the cells in the body are going to be able to function. So if you've really been following what I'm saying, this information is really wonderful, because what that means is that whether the virus was man-made, whether it was introduced through inoculations into the body, whether it was inhaled, whether it was acquired through sexual activity or through diet, you determine to what extent this virus will have its way in your body. So that means then that we have to then look at you as a whole and determine what is your level of present satisfaction and contentment. Do you feel in general that your entire life is really on the fringes, and that if any additional legislation occurs, or if there's an election of an individual that you don't necessarily agree with, etc., that now you feel that your life is going to take a turn for the worst? That is what I call fear of unknown recognition. And I say that it's fear of unknown recognition because most people feel that these types of anxieties are acceptable, and that it's okay to actually feel less than competent when things do not go your way. Unfortunately, the physical body does not agree with you. The physical body states in its demeanor of how it likes to function that whatever the experience is, it likes to always be in comfort in moving through that experience. And we do know one thing, is that when we can allow our bodies to stay in comfort in an experience, we always come out clean as a whistle and as the victor. We can identify and have experienced personally that when we become tense, fearful, inhibited, that we find things become, quote, as we say, hard, become rigid, difficulty in moving, difficulty in communicating, difficulty in opening up and sharing, because we have decided to see ourselves as a victim or not having what we are capable of needing to master that experience. Now, that moves us to another level of investigating what's happening here. Let's look at how you feel about your capacity to master the experience. Do you feel that because there has not been a pharmaceutical drug invented or a vaccine created, that you are not going to have the capacity to master AIDS if your blood is drawn and you're told that you're HIV positive? Is that a reason for you now to spend the rest of your life preparing for a funeral? And the question depends upon you and your value system, which is something that we now have to look at. You know, having done hundreds of deliveries, I found and observed something very, very interesting. Every individual that comes here with only themselves. They don't come with a little bag of pills on their side. They don't come with an inoculation needle. They don't come with a pharmaceutical drug. They don't come with a plate of food prepared on a platter that has actually been tied to them. They actually come with what you see when you are disrobed in the mirror, the sheer you. And we, to this very day, scientifically, biologically, have not been able to identify what the physical body cannot do. Now let's think about that. Now, just as I've grown up here in the scientific community in this country, we were told at one point in time that if you lost a finger or a leg, that was just it. That there was just no way that you were going to be able to have that sewn on. That was told to us that that was preposterous. And then all of a sudden we're finding out that yes, we could reattach bits of fingers. We could now reattach multiple fingers. We could now reattach a hand. Finally we reattached arms. Finally we began to recognize that we could actually do transplants of organs from one person to another, whether they were related or not. We then began to recognize that we could actually have interaction with animal tissue on a higher level, that their tissue could now be utilized to hold a space within our own physical bodies because of a deficit. This happens all the time with burn patients. They are covered with the skin taken from particular hybrid pigs called porcine. So even in my short lifetime, I have seen the belief system be totally changed from saying that this is totally impossible, it could never happen, to now being a common day, everyday occurrence. As we have these examples around us that let us know that things do change and that things are possible, is it in our best interest to decide that AIDS is an incurable disease, or to decide that any disease is incurable? Even is it in our best interest to decide that death is inevitable? Now that's an awesome thought, and we can talk about that at another session. But at this point in time, it's very important to think about how your thoughts and your belief systems really affect your physical body. A wonderful work on the effect of emotions written by Lydia Tomashuk, The Type C Connection, which is a wonderful treatise and study of over 10,000 patients with cancer and their psychological makeup. She has indicated that each one of these patients had a common emotional state: repressed anger. And what is anger? Anger is an aggressive form of fear. And it had been noted that this repressed anger, as it was identified, becoming conscious now, and then transformed by the individual by deciding to see their experiences differently, or to forgive those individuals that they thought had really done something to them that was not in their best interest, the blood chemistry changed. And as the blood chemistry began to change, tumor size also changed. Their capacity to be able to tolerate the conventional treatments for cancer also changed. Life expectancy became longer. So I have identified that this is a very, very important missing aspect from the treatment of the AIDS virus. And I talk about this treatment allowing us to have what's known by my writings as AIDS the condition. AIDS the condition stands for an advanced, integrated, divine human species. I'll repeat that. AIDS the condition is an advanced, integrated, divine human species. AIDS. Now, what kind of person is this? How does a person manifest themselves as an advanced, integrated, divine human species? Well, I'm going to give you some do's and don'ts. Jot them down and remember that these do's and don'ts are chemical realities in your bloodstream that will determine your immune function. It's important for you to understand that we have discussed and have demonstrated that your level of physical health is 100% dependent upon your emotional and mental state. I'll repeat that. Your level of physical health is 100% dependent upon your emotional and mental state. If you emotionally are not happy and at peace and at joy, if you mentally are not happy, at peace, and in a state of contentment, there is dis-ease, which is now known as stress in the physical body, which definitely alters the state of the cells from functioning at their optimal. This allows you to be susceptible to whatever may be in your environment that can live in a bloodstream such as yours, who is not contented and at peace and in harmony. So, an advanced, integrated, divine human species is an individual that is capable of staying in a state of harmony, peace, and joy all of the time, irregardless of the experience. How? Well, what an advanced, integrated, divine human species does on a physical level is keeps the body bathed and showered, and at least twice a day now. Why? Because of all the pollutants in the air, the toxins now that we acquire from our clothing because of the treatment of the fabrics, and especially if you're wearing synthetic fabrics, must be removed from the skin. The hair and nails must be kept clean. Too many of us feel that manicures, pedicures, professional hair care is ornamentation. It is not. It is a necessity to keep the end sensory organs of the body clean and activated. It's important to apply natural edible oils to the skin. There are so many cosmetics on the market now that contain all kinds of things, from horses to cow hoofs to human placenta to all kinds of chemicals that immediately will enter the body through the skin. You must be aware that the largest mouth that you have on your physical body is actually your skin surface area. It is the largest organ of detoxification and absorption. So that means then that what you put on your skin should be edible. You should be able to drink it or chew it and eat it. And if you can't eat or chew your cosmetics, etc., then there's something not correct about putting them on your skin. Be very, very careful. Eat and drink clean foods and fluids, fresh vegetables, grains in season, fruits in season. And in season is defined by what is happening in your environment